course. Yeah.
I thank Audrey she's going to be my driver today. When I do these presentations, I just like to talk to people, and I want to just sit here and chat about what we are talking about. BlackMyeloma.health.org. I want all of you on this call to remember that website, and I want you to visit it, please. You don't have to do it now, but BlackMyeloma.health.org is what we just launched the last day of March. So we were excited about that launch. And it is just another tool that is connected to HealthTree, integrated into HealthTree.org, but for African Americans to be able to go to as a resource and easily find information and resources that pertain to them. So I appreciate HealthTree for asking me to speak on this topic, because I think it is so important for everyone, and certainly within HealthTree Foundation. Next slide. So this is the agenda. These are the things that you'll hear from me today. You're gonna hear my perspective on why such an initiative is even necessary. You'll hear the mentality that we on this African American Myeloma Initiative team have. I mentioned the health disparities a second ago. I want to spend a little bit of time on those. Sometimes I think we assume that people know what those disparities are, and I don't want to make that assumption. You'll hear about African Americans and multiple myeloma, just the facts of the disease as it relates to African Americans. You'll hear about the goals of the initiative, community, and how we're trying to make this community stronger. And then one of the most important things is engagement and volunteering. And I include everyone in that, because everyone can help in this initiative. Next slide. So Audrey mentioned health equity, and I want to spend a little bit of time here. This slide here, it's a lot of words, and I usually don't put a lot of text on my slides, but this is a case study of sorts from UNC Health System, UNC School of Medicine. So down in North Carolina, Chapel Hill, University of North Carolina School of Medicine. I literally took a lot of this, not every word, but from their website as they talked about health equity. So let me talk about each of these words. Diversity. Diversity is just how we are the same and how we are different. So just think about your community, think about your workplace, think about your church. We are the same in some respects, but we are different in other respects. And you see all of those ways that we are different. We are different age and race and language and education, even our values and our beliefs, political beliefs, religious beliefs. We are different in some ways. So when we talk about diversity, that includes populations that have and still are underrepresented and marginalized in our society. And that's just another way of saying there are certain populations that are treated as insignificant and on the outskirts and on the edge and not in the mainstream, this whole idea of being peripheral to the society. So what diversity does is it incorporates, or it includes, it involves those marginalized and underrepresented groups of people, not just by race, it can be by any other characteristic. So that's what diversity is. Equity. Equity ensures fair and just opportunities. And since we're talking in the realm of healthcare, that's what I'll talk about. So that would be fair and just opportunities for patients. And then for coworkers, because like I said, I took this from UNC. And that's opposed to just being equal. And I'll explain that in a little bit, why equitable is not always equal, because there are other social determinants of health out there that create barriers. So something that you might think is equal might not be, because there could be people who face these other things that some of us don't have to face, like lack of transportation, like lack of finances, literacy, perhaps didn't go to school or finish school or can't read, can't understand big words, and food deserts. Food deserts have become, in the last few years, a major, major issue. And that's in an area where they are not able to get fresh produce, fresh fruits and vegetables. They're just not there. And so that affects their health. So all of these other things called social determinants of health can also impact whether something feels equal or not. This equity also includes promoting justice, impartiality, and fairness within whatever the procedures are. Okay, so there's diversity, there's equity, and then there's inclusion. And that's just being intentional and deliberate about creating a welcoming and respectful environment for everyone. Again, when I'm talking healthcare, and that's for everyone on the medical team and for every one of those people that are being served by the medical team. It's an environment that is truly inviting to all. Sometimes people say we welcome you, and sometimes they are just paying lip service to that. We know when we feel welcomed. It's a heart thing. And so organizations are paying attention to that. And part of feeling welcomed is having a workforce that reflects the demographics of the people that are being served. So think about that for a second. If 50% of the people who are being served in a hospital system are non-Caucasian, then their workforce needs to mirror that, because that helps the non-Caucasians feel welcome, thus feeling included. So that's what those three words mean. This statement at the bottom, the UNC School of Medicine actually has a DEI council. And this was their statement, again, from their website, and I'll read it quickly, but this is what they've promised to do. This is part of their vision, part of their goals. Health equity means ensuring that every person in every community can get the same high quality care, regardless of individual characteristics such as ethnicity, gender, or geographic location. A number of social, economic, and cultural factors significantly affect both physical and mental health. We strive to recognize and eliminate these disadvantages that lead to healthcare disparities through initiatives that increase diversity in leadership, improve training for cultural competency, and strengthen community partnerships. So that's what they say about it. Next slide, please. So this is what I want you all to hear. This is a word from our leader. This is a word from Jenny. I think it's important that you hear Jenny's perspective on this, because I am a proponent of from the top down. I am a proponent of leadership being bold about their feelings about whatever it is, their perspective about whatever it is. And I feel like if you know that perspective, it gives you a license to perhaps change your way of thinking. But these are actually Jenny's words, and I need to read them because I want you to hear them. The myeloma incidence in the Black community is 2 to 3 times higher than any other group. There is a deep need to reach these patients. We've provided all of our myeloma programs over the last 10 years, and we realize that the Black community is not taking advantage of the programs and services we have to offer. There is a great need to try new approaches. The African American myeloma patients are not living as long as other multiple myeloma patients because they are not getting the same care, even with lower risk multiple myeloma genetics. Self-advocacy will go a long way to help improve outcomes. The goal is great care and education for everyone. That's from our leader, and I appreciate this word from Jenny. I thank Jenny for how she feels about this. And as she said, what was going on the last 10 years was not working, just not reaching the AA community. So other approaches. So I'm happy to say, and you can go to the next slide, that this initiative that I am directing and working with our team, this is the trying new approaches. This is a grassroots effort to try. You have to meet people where they are. And while I give kudos to HealthTree Foundation for trying and attempting and putting programs in place and reaching out and out in the communities, the Black communities, they absolutely have been doing that before I ever arrived on the scene. And I thank them for that. And that was one of the things that drew me into HealthTree Foundation, because I felt this genuine concern to reach all people, including African Americans. So I want to explain a little bit about our initiative. And this is what I call my cultural insight. Because as you see more and more things from us, whether that's the website, whether it's brochures, it could be anything, events, there will be some images and there's some language that I need you to keep in the back of your mind, because that will help you understand holistically what this initiative is about. So the cultural significance of images and language. When you think about African Americans as a body, just as a people, we're strong. We are resilient. We've had to be. When adversity hits, we know that we can't fold. We know that historically, and it goes way back, we've had to look within ourselves, within our homes, within our churches, within our circles, communities, to find help, because we knew that in order to be strong and endure whatever those adversities were, that we had to come together. So we're tribal. And that just means sharing. We share common culture and common traditions and common values. And each ethnic group has the same thing. You share common things. For African Americans, having a village is the norm. I talk about my village all the time. I talk about when my husband got sick. So I didn't say this. Oh, actually, yes, it was in my intro. My husband was diagnosed five and a half years ago with multiple myeloma. That was devastating to us. And when I fast forward to now, it was my village that kept us. It was the people around me that were calling me and doing and coming to the hospital and feeding and all of those things. So a village is what we talk about. Life is not meant to be done alone for African Americans. That's just how we think. And when you look at the bottom, this West African icon, that is the icon that is symbolic of help and support. You will see that on our website. You will see that on our brochures. You are going to see that, because that means as you give, you shall receive. We are here to help you. We are here to support you. Now, the hands, you will see those on the website and in different places. The hands represent helping each other, lifting those up who are in need, supporting, praying, holding to God's unchanging hand. So even from a religious or spiritual standpoint, hands are important to us. That holding to God's unchanging hand, that is actually a song that I grew up in church singing. And at my mom's church to this day, they still sing that song. So there's a picture that most African-American families have some variation of, and it is one hand reaching down to another hand, and it's like they're pulling that person up or holding on to that person. So it's very important. And all of that is about this sentiment of, I am my brother's keeper. I'm sure you all have heard about Kwanzaa. That's the celebration in December of African-American culture. Ujima is one of the principles, and it means collective work and responsibility. And that means building and maintaining our community together to make our brothers and sisters' problems our problems and to solve them together. So again, it just reemphasizes that idea of helping my brother and being there. We lean on each other. So keep those ideas in mind as we go forward. So I want to talk about disparities. And this picture represents, I call it the myeloma tapestry. So disparities in healthcare in general, we're talking about, but also we'll talk about multiple myeloma specifically. I want to stay on this slide for a second. And all of you on this call, look at this. This is a quilt. It's woven together. There are blocks on here. Like, imagine yourself on this myeloma tapestry. I don't know exactly who's on this call, but I know that patients are, that caregivers are on this call. Think about your journey. Where are you on this tapestry? Because you're on it somewhere. Think about all of these other blocks. And it's almost, when you start to think about it and you start to, it can be heartfelt, because as you look at each one of these blocks, you think about, wow, that's a myeloma patient. And that patient has a story. And you see how that they are roughly the same size. They don't look the same, but they're the same size. So when you really sit back and think about this woven myeloma tapestry, I'm sure that you're hoping and praying that each person on this tapestry is getting the best, and that each person is getting exactly what they need. And because everybody's journey is so unique, it may not be the same thing, but praying that they get what they need. Next slide. This whole idea of a tapestry, it is emphasized by a renowned poet, Dr. Maya Angelou. And this is her quote. She said, "We all should know that diversity makes for a rich tapestry. And we must understand that all the threads of the tapestry are equal in value, no matter what their color." Again, think back to the slide before. It doesn't matter what your block looks like. No one is more valuable than the other in this myeloma tapestry. There are challenges for every patient, every myeloma patient, every myeloma caregiver. There are challenges that come up. So we have to value each life equally. Here's where equal makes sense, no matter who that person is, represented by that thread or represented by that block. We are different, and we have to, again, go back to diversity and inclusion. We have to embrace that, but we also have to value each life. Next slide, please. So those two slides, those are the feel-good slides. You know, Dr. Angelou talking about, you know, we value everyone, no matter what the color of the threads or the block, and you pictured yourself in the myeloma tapestry. But this slide here, this is the hard reality. So this is what this initiative is all about. This is why the African American Myeloma Initiative is even needed. And I am going to go through these things. I won't read every word, but I need you to almost put yourself in the shoes as a myeloma patient or caregiver. Put yourself in the shoes of a person who experiences these types of things as a myeloma patient. So first of all, dismissal of symptoms. For African Americans, I don't know if you know this, but we're not always taken seriously in the healthcare field. Initial symptoms are not always properly evaluated. And let me say right now, the disclaimer, I am not by any means saying in every single situation, because that's not true, but in many, many, many situations, like one is too many because every life is valuable, but we're not taken seriously. And sometimes there are racial biases, either conscious or unconscious, that medical professionals might have. And here are a few of them. There is this myth out there that African Americans have a higher pain tolerance. I don't know where it came from. There's this thought out there that African Americans may come to the ER saying we have back pain because we are looking for drugs or we are looking for painkillers because of perhaps some addiction. Perhaps, but perhaps other demographic groups do, other populations do the same thing. There's this thought of when you see me with my brown skin, my education level is questioned. Like before I ever say a word, like, wonder how much education this person has. As sad as those things are for me to say out loud, it is a reality. So African Americans many times are not feeling seen. You know how everybody talks now about, I want to be seen. I don't want to be minimized. I don't want to be overlooked. If I come to the ER and I say I have back pain, then I need you doing everything that you would do for anyone else who is non-African American to help try to figure out what really is going on. And let me say this, and I will tell you a few anecdotes as I talk about my own journey and my husband's journey. I did take my husband to the emergency room in January of 2017 because he had been having problems. He still was not diagnosed. We didn't know what was going on, was trying to be diagnosed. He almost collapsed. I drove to the ER, pulled my car up at the door, basically went in and said, my husband needs to be seen. Can you get me a wheelchair? And that lady really did. I'm sorry, I'm going to close my window. I just saw a dog out in the yard. The lady looked at me. She just looked at me. Well, what's wrong with him? Well, ma'am, I don't know what's wrong with him. I'm not a doctor. I know he needs to be seen and he needs to be seen now. And she proceeded to just, play 20 questions with me. So I started looking for a wheelchair because I was going to take the wheelchair out and I was going to bring him in myself. And when she saw, the more I talked to her, I guess she figured, okay, this is legitimate. And in those moments, I was like, ma'am, you are really messing with the wrong one right now. Please don't do this because I'm disturbed and don't do this. And she did send a gentleman out that helped us in. And within about 2 hours of getting in that ER is when the doctor said to me, his kidneys have failed. So the protein had blown his kidneys out. We didn't know. And we're admitting him and we have to get him to dialysis right away. And then the ER doctor looked at me and said, I think it's multiple myeloma. And I just looked at him like, okay, sir, but I have no idea what you're talking about. But I have to say, that moment of this lady just not really taking me seriously, we did not, after that, we did not encounter too many moments like that. And I'm thankful for that, but that happens. Another thing that happens in the African American community is misdiagnosis or delayed diagnosis. The medical staff does the bare minimum, which prevents timely diagnosis. They're not performing diagnostic tests. Minimal early screenings are being suggested. There's this lack of complete diagnostic process that happens for many African Americans. Another thing that happens is the medical field accepts that African Americans are normally anemic. Like that is a thing for us. And it's normal. So they are failing to investigate the cause of anemia. And the more and more I'm hearing especially African American myeloma specialists, they said, make doctors and nurses investigate that cause for anemia, because that is not true. We're not just typically anemic. And I think about it, in my household, 5 of us, at some time, all of us have been told that we're anemic, even the kids when they were younger. But no one investigated it more. So those are some other things that happen. Additional contributing barriers, still talking about disparities, inequities, reasons why we need this initiative for multiple myeloma. African Americans are unaware quite often of the treatment options. There's a lack of access to information about myeloma. There's a lack of appropriate and high quality care. African Americans don't always get those new therapies coming out, and it could be for several reasons. Sometimes it's assumed the insurance won't pay, so they're not offered. That's not an assumption to make. You offer it and then see what happens. Sometimes it's location. African Americans might not be close to an academic center. And here's an example. Washington University in St. Louis opened a satellite office close to a Black neighborhood because of that very reason. So they are trying to bring the academic center to the neighborhoods. Other contributing factors to these disparities and inequities, differences in access to stem cell transplant therapies. African Americans don't have a lot of knowledge, and the knowledge that they have might not be accurate. Here's a biggie: clinical trials. African Americans, there's limited involvement. There are disparities, and it goes way back. Sometimes the medical staff, they aren't speaking in language that's understandable when they are presenting about a clinical trial. And so then that makes African Americans nervous because they don't really understand it all. Dr. Craig Cole from University of Michigan, one of the African American myeloma specialists, I heard him talk about this. And he said language matters. He said to call them clinical trials to African Americans, and that carries baggage. I'm sure you all have heard about the Tuskegee study and the inequities that were performed on African Americans, and people died. We know that. We might not know all the details, but in the African American community, we think about that. And we are saying, no, you're not going to experiment on me. I'm not going to be the guinea pig for your study. So Dr. Cole was saying, instead of calling them clinical trials, talk about a clinical option might be better. Partnerships are not always emphasized, or a collaboration between the patient and the medical staff, because you have to build trust with African Americans. We are not going to just accept what you say. And so one thing that Dr. Cole said at his hospital, all medical staff members are aware of clinical trials, not only the doctors and nurses and nurse practitioners, but even the social workers and the people who might be checking people in, because maybe I, as a patient, might have trust in that social worker who can talk to me about, oh yeah, there is a clinical trial. So those are the kinds of things that we have to do. There was a myeloma crowd roundtable this year in February addressing healthcare disparities. If you're interested, you might want to take a look at that, because it'll tell you more about the disparities. Next slide. So those were the disparities. That's why this initiative is even needed. Here are the facts. I'm going to go through these very quickly, but these are facts. African Americans and multiple myeloma, there's a greater incidence. African Americans are 2 to 3 times more likely to develop multiple myeloma. African Americans have a higher incidence of MGUS. While the national population is in the US 13.4%, Black myeloma patients make up 19% of US myeloma population. We present with multiple myeloma 4 years younger than Caucasian counterparts. White men out of 100,000 cases, 8.8 cases, Black men, 16.5 cases. You see that's double. White women, 5.7 cases out of 100,000, Black women, 12 cases. Now, this is it's encouraging, but, and it's probably what gives us hope. Black myeloma patients typically have lower risk myeloma at diagnosis and can or may have better outcomes than Caucasians if treated with equal therapies. And again, therapies are therapies, so I can say equal there. There is a potential for better outcomes if African Americans can have access to all of the treatment. Next slide. So the goal of this initiative, the African American Myeloma Initiative, we are trying to put a spotlight on myeloma in the Black community. Next slide. We want to spotlight it. We want to show people, here's our team. This is part of our team. I'm the director, as we said. Valerie Trainum is awesome. Valerie leads the African American community chapter and the African American Facebook group. She has done a phenomenal job of creating trust. Again, trust still has to be created with us and patients. Just because we're all African American does not immediately mean that we are trusted. Valerie is engaging with patients and caregivers every day. She's also a coach, and she is growing both of those groups. We have Diana Valentine, which I'm sure you all have heard. She is also a coach, and she's our financial program director at HealthTree. She's there helping with financial matters, and it doesn't matter who it is. You don't have to be African American to benefit from her knowledge. And we also have Constance Boyd. She is our new patient navigator. So Constance will be working one-on-one with certainly the African American patients, but also some of the other patients. But we are also happy to have her on board, again, just to be a face. Sometimes patients want to see people that look like them. So that's what we're trying to do. And then we have other people in the background that are helping us. Next slide. Here are the goals of this initiative: awareness, education, outreach, and advocacy. Awareness. I told you, the doctor said multiple myeloma to me, and I was like, okay, but I don't know what you're talking about. Awareness is low in the African American community. What is multiple myeloma? Like, the question is just that simple. What is it? And we're trying to change that. Education goes hand in hand with increased awareness. We want to educate people. What tests should I request? What are the symptoms? Like, even what are the symptoms? Is this, my kidney numbers aren't good? Could that be multiple myeloma? My bones hurt, my back hurts. I have compression fractures, which my husband had. Could that be multiple myeloma? Just asking that question to force the medical community to stop and say, I don't know, but let's test. Outreach. This is all about empowering communities in their pursuit to enhance the well-being of everyone. And then we're always looking for what community partners can be leveraged. They don't have to be African American. There are non-African American community organizations that still have African American members. So we are open to partnering with those organizations too. And advocacy, we are creating resources and providing the patient navigator, as I said, Constance is on board to support current patients. And the whole patient experience team will still be a resource to all patients, to the African American patients too, but we also have Constance. What barriers can be eliminated? How can fair and equitable treatment be achieved? That's what advocacy is all about. So when you put all of these things together, and if we are successful at awareness, education, outreach, and advocacy, then we create a strong community. And it's essential, I mentioned this, it is essential to build trust in the African American community. It is a difficult thing to do. It must be earned. But once it's earned, hearts and minds are then opened. And that's when the magic happens. Change happens. We're all locked in. We're all working towards the common goal. We're all in this 100%. And this is when we can make the change for African Americans with multiple myeloma. Next slide. Community, we're just stronger together. This picture here, it just represents, again, it's kind of like the myeloma tapestry, but it's the piece of the puzzle. We each have that piece of the puzzle. You see the hands again, and we're together putting this puzzle together. We know that we are stronger together. It has been proven in our culture that we are stronger together. Next slide. These are some of the programs and events that we are working on right now, and I am so pleased. So I joined the middle of January. So we just, I've been here about 3 months. The first quarter we just ended, and here are things that are in place, and I couldn't be happier. Spotlight on Myeloma. Those are patient videos. That's our video series that Valerie has worked so hard in getting people from our Myeloma Black Facebook group and the African American chapter to do these videos, and we have them on the website, which we're going to show you in a few minutes. My Brother's Keeper campaign. We will have different touch points throughout the year. Here are 3 of them: Juneteenth, Kwanzaa, and Black History Month, where we will write articles. We will do online campaigns, again, trying to get the word out to African Americans. We also, as I mentioned, the African American Facebook group we have, very active, the African American community chapter. We are going to do in August a virtual 5K. It'll be the first, and it's HealthTree Moves for African American Myeloma Awareness. And Lindley is helping us with that, and I'm so thankful for her. And we hope that this will be a big event. And I ask all of you on this call to join us in this awareness effort. We are participating in health expos and other cultural events, family reunions. African Americans are big on family reunions, whether it's your immediate family, or there are things across the US called Black family reunions, where you bring your immediate family with all these other families. There's actually one here in Cincinnati in August. And there's music and food and Black businesses and medical booths, and people can have their blood pressure taken, and the health aspect of it. So we're participating in those. I'm participating the end of this month in Cincinnati in a health expo in downtown Cincinnati in one of the parks. We will have music, food, fun, booths out there so people can learn about different diseases. We are out, part of our outreach also is to cancer centers, social workers, hematology offices or oncology offices, primary care physicians. We are starting to form, relationships with these different places, and they are requesting that we send our brochures to them. And then we're always looking for partnerships locally and nationally. Next slide. Engagement. Here's where this is my favorite part. It's just all about doing good in the world. This feels like doing good in the world to me. Yes, it's professional for me. Yes, it's personal to me. I have a vested interest, but this is doing good in the world, informing people about a disease that affects you. Next slide. And here is where I ask everyone to help. Together we can do this. We can make a difference in the lives of everyone. We can spread this word. We're not excluding anyone, and we need to include everyone, and that's what we're doing. Again, it takes a village. So think of the things that you can help. We're going to go through the website in a second. Next slide, I think, is just my thank you for attending. I appreciate it. Here's my email address. Please email me anytime there are any questions. Marsha at HealthTree.org, BlackMyelomaHealth.org is the website. Please visit. We're going to take a look at that very quickly now. And we're going to look at it quickly because I want you to go back later when you have some time and really take a look at it and really think about who you can forward this website to, this link to.
Hey, Marsha, before we get on to that, there are some questions in the chat that I wanted to get to. And because we're running a little low on time, I thought, would you rather show the website or what would you?
Let's do the questions and then we could take even 2-3 minutes at the end to show the website.
Okay, let's do that. So first, just comment is from Lisa. She says, thank you so much for this valuable information. You are so correct. I had to go through so much before I was actually diagnosed with the correct diagnosis. I know my body and was extremely persistent with finding the right doctor that listened to what I had to say. So Lisa, thank you for sharing your personal experience with us there because like you said, Marsha, one is too many, but this definitely happens to more than one.
It does. Thank you, Lisa. And I hope that you have found what you need.
Yeah. The other two questions are a little bit more, I'll say, intense. And they're kind of questions that we anticipated coming into the event today.
Mm-hmm.
The questions that we'll start with regards, how do you know the authenticity of a brand? It's popular now to celebrate Black History Month as a brand, which is wonderful and great. But there are some people out there that do it for the popularity and word of mouth versus for the right purposes, it seems. Do you experience that? How do you deal with that? And how can we move forward with trust?
Let me speak about, say, and I'll use Black History Month as an example, the authenticity. As soon as you said that word, I'm thinking, why is someone even questioning the authenticity of a person or an organization who is celebrating something like Black History Month?
Right.
So I don't know if this person is saying, you know, maybe there's some commercial aspect of it where you sell things or you make money. I have not experienced that. And every person, every African American that celebrates Juneteenth or Kwanzaa or Black History Month, that is their own personal thing, right to do. And as a culture, we are not sitting around thinking about how can we make money during Black History Month?
No, I think the question was more towards popular brands already that are maybe using something to get gain.
Oh, like other brands that are out there.
Yeah.
Okay. I see. Not people. Got it. Yep. Sorry about that. Okay. No, so brands, I don't think African Americans are going to sit back and try to figure out if Nike, and I'm just using them as an example, if a brand is being authentic or not. Because if they are doing something for Black History Month, I'm appreciative of it. Okay. So whatever their underlying agenda they might have, if Nike wants to sell a shirt with the swish swoop on it, whatever it is, during Black History Month, but they are advertising Black History Month, I don't care. So, but trust, let me speak on trust. Trust is that's just part of it. I don't think we are going to, we meaning African Americans, are going to try to think through if I trust that company or that brand or not. Because if we're not patronizing them, then I don't care, again, what their reasoning is. Just help us celebrate and leave it to me to then see what you do after Black History Month or after Juneteenth, to see what you're doing in terms of what are your hiring practices? Does your board of directors look all Caucasian, all men, like that kind of thing?
Okay. Awesome. Thank you. Barbara's wondering, I want to volunteer and raise awareness in my community. I do have a healthcare background. Where do I start? Do you want to show on the website? Let me pull that up.
And it's emailing me, Barbara, please, Marsha at HealthTree.org. I am open to individuals emailing me and I will get you involved. But so we're going to look at the website, blackmyelomahealth.org. See right there under those 5 green buttons, get involved, volunteer today, see opportunities, click on that. And this just talks about, again, why it's so important that we need everyone. And see that those bullets there, those are some ways you can get involved. And I'm going to change, like as new things pop up, like I don't even have the 5K on it. I will be changing what we need. So come here often and look. But if you see something, let's say you want to participate in a local health fair, or you want to leave brochures at your cancer center, that 4th bullet, come down, click on learn more about opportunities to help, Audrey. I don't see it come up.
It's okay. It's because it popped up on my other screen, but it
Oh,
directs you to send an email to Marsha.
that's right.
Oh, sorry. It just popped up on my other screen, but
That's okay.
it's literally, if by clicking that button, it will direct your email to send an email to Marsha.
Marsha at healthtree.org. Just, you can go through this. I wanted to make it easy for people who are on the website, but you can also just email me.
Yeah,
Okay.
yeah, for sure. Let me put your email into the chat as well so that
Yes, please.
I can connect with you. And then Angela is saying, thank you so much for this information. I'm a Latina and this info has been so valuable. I have trouble articulating the concerns that affect our community, and you have articulated this beautiful and have taught me so much. Thank you for this hard work on your initiative that is so needed. I love this too, because it crosses, even racial like barriers of like, there are Latinos that experience disparities, there are African Americans, there are Asians, there are so many people out there experiencing these disparities. And a couple of the comments that I got was, isn't this just victim mentality? And I in some ways I understand where they're coming from if they grew up white like me, honestly, because that's the easy way, I think, to see this. And I don't think the people that asked it with bad intent. I think they're seeking to understand, and they're here today, which is a great step, right? Moving forward. I think the balance is we need people to know about these disparities. They need to be shared. They need to be said so that me and my grandpa and my other generation can really understand what's going on outside of our world. And like you said earlier, there are some African Americans, Latinos, Asians that will play the victim mentality. There are white people that play the victim mentality. There are all races that play the victim mentality, but that doesn't mean that their culture or their race is playing the victim. Does that make sense if in my passion and explaining?
Well, it does. And let me say one thing to the person that asked this question. I want you to think back to that myeloma tapestry. Remember the blocks, and put yourself in a block, put my husband in a block, put Jenny in a block, put every other myeloma patient you know in that block. Who has the right to not be valued when it comes to life and death? That's how I want you to think about this. Like playing the victim mentality, I'm sure people out there play it of all ethnicities. It does not matter when it comes to some other things. However, when it comes to life and death, this is a life we are talking about. We are talking about a disease that is horrible. We all have that same right. So no, it is not the victim mentality.
Yeah. Thank you for articulating that. And I also wanted to let Angela know, yes, we're working, we talked about the African American initiative today. We are also working in translating all of our programs and advancing our website in Spanish. The majority of our patient experience team speaks Spanish. And we continue to grow in our efforts for diversity, equity, and inclusion for Latinos, as well as African Americans. One of the Latino barriers that people experience in healthcare today is the lack of appropriate translators in medical facilities. That's a whole different topic, but I think these are real things that people are experiencing and going through. And like you said, Marsha, a life is a life. It deserves to be valued and taken care of, especially in a healthcare setting.
And Angela, I wish that I could lead the Hispanic myeloma initiative. I can't, but I know that HealthTree is working towards trying to eliminate some of the language barriers. So hang in there.
Lots of people saying that they're willing to volunteer. Somebody asking if they can connect with a coach. Go to, I can put it in the chat, but you can look on www.myelomacoach.org and look for people who are available.
Let's look.
Several. Okay, let's look together. There are several.
Let's look real quickly at because there's a way to get to coaches through blackmyelomahealth.org. Okay. And this will be a good page to show the coaches. So again, blackmyelomahealth.org, there is a tab that says our team. I'm sorry if I'm bouncing back and forth, Audrey. Our team tab, click on that. And then you'll see the 4 of us that I just showed you. And then here's the coach team. So this is some of our African-American coaches. It's not all of them. And then click on connect with the myeloma coach, which takes you to exactly where.
Yeah, I'm logged in, but it would take you to this.
Yes. Yes. So yeah, yes, absolutely connect with a coach.
Like you were saying, we have even more coaches that are Black that, well, we plan to be adding to this as well. Is that correct?
Correct.
Okay, perfect. So let me share this in the chat as well so that people have that resource. Wonderful. Okay.
What else?
Somebody said the statistics are the rebuttal to the victim mentality allegations. And again, I don't want to make this divisive. I know that the people asking the question were sincere. Mm-hmm. They are, looking to understand, seeking to understand. Mm-hmm. I think it's true when we look at the experiences, the statistics, again, just real life experiences where we hear about what's going on.
And science is science. And in the medical research, the numbers aren't lying. 8.8% white men, 16.5% Black men out of 100,000. We have a higher incidence.
Mm-hmm.
So, what else?
No, that's all the questions. We are nearing the time to end. Is there anything else on the website that you wanted to show them?
Just go back to it quickly. The landing page is everything I explained in my presentation here. Black Myeloma News. Everybody is seeing a lot of that. I just pull certain articles that I find that are helpful for the African American community. The myeloma specialist, let's click on that real quickly. We have 4 so far. We'll probably be adding a 5th one, but these are the African-American doctors who are the specialists and see many, many African-American patients. And see the links at the bottom, research and publications. Go to those and read those. Those aren't necessarily just for African-Americans. You might learn something from those articles.
Awesome.
So we have that. And the only other thing, let's go real quickly to the community. I want to show the spotlights on myeloma videos. So all of that you've heard about, Facebook and the community group. Here's some upcoming events. I post those here. And then here are our patient spotlights on myeloma videos. So like I said, Valerie has done a phenomenal job. I think we have maybe 8 so far. We always put 1 on the landing page and then all of them are here, but go listen to these people. The stories and their journeys are just, it just warms my heart to hear them and hear about how well they're doing, and even the challenges. I think they will help you.
Yeah, it's amazing what's been done. You guys are really taking this by the horns. Is that the phrase? And
That's the phrase.
making it happen. So
We're trying. We can't do it alone. I enlisted everyone's help. Frequently asked questions. We did this purposely. This takes us out to HealthTree.org. So this is the main website. That's what I was saying, how we're so integrated, because there's so much knowledge on HealthTree.org. We didn't want people to miss out on it.
right. Right. Awesome. Well, I'm so excited about this initiative. I'm grateful for the comments. I'm grateful for hard discussions, because I mean, that's part of what's going to get this program moving forward, is getting everybody to understand and the importance of why this program is needed. So I appreciate you, Marsha. I appreciate everybody that attended today, who's watching the recording, everyone. And we'll just finish up with a couple of outro announcements, but thank you for taking the time, Marsha, to share with us today.
You're welcome. I enjoyed it. And thank each of you for listening.
Oh my goodness. I don't know. My computer's being so weird today. Let me try one more time. Sorry, everyone. Here we go. Maybe. I think I did a reboot and it changed everything. Kind of frustrating. All right. So join us next month, May 12th. We're going to be talking about HealthTree University, which is free myeloma education for all. HealthTree University offers free classes to learn more about myeloma. And whether you're a novice in the world of myeloma or curious about the mechanisms of the latest FDA approval, HTU or HealthTree University is right for you. And again, that's on May 12th with our new member, Clark, and also Cindy, who's always been the curriculum director. You may be interested in other community events. Tomorrow is our second session of the Northeast Myeloma Community Chapter. We'll be having a coach-led discussion about living with myeloma without defining yourself by it. And that's for whether you're a caregiver or a patient. Tuesday on the 19th at 1 p.m. Eastern is our stem cell transplant chapter. We're going to be hearing about the importance of walking and fitness during and post stem cell transplant with Tiffany Richards. And then the 20th is our Mountain West myeloma chapter, and that's a question and answer session with Dr. Godara. The link to sign up for any of those events and even more events I did not mention is found at the bottom of the slide and will be sent out within 48 hours of the event's conclusion. As always, I'd like to thank our sponsors, without whom this would not be possible: Bristol Myers Squibb, JSK, Genentech, Janssen Oncology, and AbbVie. And thank you to each of you for helping us build a strong myeloma crowd community. I appreciate you and hope that you have a great rest of your day. Thanks all.
Bye.